anything with varus wedge?
I used to early on. I find basically if a patient needs a varus wedge, I will just put it into the orthotic. I will build it inside. I won't build it out. I think in the older days they would do a lot of wedges on shoes. Like you just don't see that anymore. It's just you wedge the orthotic.
Right.
So
And there are many companies that wedge the midsole.
No, I mean the only thing I've never really seen many shoes advertising wedges. So if I want a wedge, which is maybe one patient a year, I'll send them over to Bob, and they'll do it.
Yeah.
They'll do that work.
And what is that? What is the complaint that requires varus wedge?
Well, generally posterior tibial tendonitis and medial, like inside of the ankle pain, where they're pronating. But again, if you just put the wedge on the orthotic, they can move that around.
Right.
I mean, I always thought that maybe a shoe company was missing the mark. But why not make a removable orthotic that can be modified? Like, why not? I think it was Nike that did that once in a while. They would have like an arch pad that you could put
and
in
you
and
could
take
glue
out.
on a different pad.
No, why not make something with a Met pad that can, because Met pads are really common and lots of people want them.
Right.
But I've never seen one. Why not put something with a Met pad, or even like, say patients have pain on the ball of the foot, like under the metatarsalgias come, right? And you can put them into a rocker shoe, which can sometimes cause their hips to go out, or if they're not balanced, they can. Or why not just make, we use dispersion pads, right? So dispersion pads. Why not make like dispersion pads that can be put on under any metatarsal, something like that. Like underneath, like you can like get an insert that instead of like say it being something that is more dense, like if you're familiar with like Plastizote.
Yeah.
Like you can have like PPT or shock absorbing material with Plastizote over it, and when the patient walks, it'll kind of leave a mark where their lesion is, and then they can flip it over, and then it'll come with like certain dispersions, and they can just put it wherever the dent is, and kind of make their own, something like that would probably, I think, maybe be useful. I don't know if how well it goes.
Yeah.
But,
no, just fishing.
Yeah, inserts. I think wedges on shoes. I don't know how well.
I don't mean it necessarily on the shoe. I mean constructed in the shoe.
Okay, I see what you mean.
Instead of, we often think about, our footwear from heel to toe. There's a lot of research, and there's some very well-known doctors who are out there talking about, well, there are people with medial knee pain, active people. Are they in the right footwear if they're in this heavy-duty stability shoe with a medial post, when it actually could cause more pain? So why don't you think about the shoe from the lateral to the medial side and construct a shoe that accommodates or sort of mitigates that pain. So in terms of wedge, it would be a different density, one lateral to medial, still fully supporting the foot, but allowing, one of the things I often talk about is slowing the rate of pronation, not to try to eliminate it.
No, that's bad.
So how do you slow it? And you can do that maybe with different compounds or densities of foam, etc. So I didn't mean necessarily like lateral.
It wouldn't be like an actual build-up.
No, it wouldn't be a build-up.
It would be the sort of interior, the midsole itself, be sandwiched.
So that in other words, it would be a different density on one side rather than the other side.
Right.
But if patient is, I'm not an orthopedist that treats knees, so I'm not going to, but I'm just, typically from what I know, if patients have medial knee pain, it's usually because they're pronating too much. So you want to give them a varus wedge. You generally want to, is this what your orthopedist is saying?
Yes.
So in order to do that, basically, I don't see any other way than actually doing it either with something in the shoe or orthotic. I don't know if just making something that's completely level, that's just...
Well, they are, maybe you can explain how it's not two pieces of foam on top of each other. It's a density...
It's like a wedge,
yeah,
but it's
it is
two different hardnesses of foam.
Right.
So when you're weight bearing on it, yes, you do get some angle that comes into it, but when you take your weight off it, then it comes back.
I see. So that's different than motion control in that way.
Yes.
And,
So would you have patients come in complaining of medial knee pain?
yeah, and typically I do, and many of them will find relief with an orthotic. Not everyone, but lots of them do find relief with an orthotic. So.